and it's always a pleasure and an honor. Hello dear viewers, this is your favorite program, the Online Pregnancy School. My name is Dr. Linda Vanut, and it's always a pleasure and an honor to come your way with a very interesting topic about pregnancy. You know, the goal for this program is that everybody would know about pregnancy, what we should look out for, what we should be concerned about, and why we should seek medical care anytime during the pregnancy and even after delivery. And that is why I always bring you experts on this program. Let's go for a short break. Welcome back. This program is sponsored by Promise Ghana. We are concerned about you being healthy. Vanuatu International, we take care of your development. Reverse Star, if you're having a party, a wedding, or anything that will bring people together, being mindful of the COVID season that we are in now, use Reverse Star because it's hygienic. The drink will come from below and your guests will be amazed. And because we are again in the season where we have to continuously wash our hands, remember to use Bubble Gold liquid soap because that will keep your hands clean. Dear viewers, we have done so much. We've spoken a lot about pregnancy, but somewhere along the line, some women develop what we call complications in pregnancy. And this is what we want you to know about. There are some of them that are common, where everyone knows about it, but there are also others that we may not be so conversant with. And that is why today it's a delight for me to introduce my guest. My guest for today's program is a colleague, a friend, Dr. Emmanuel Srofenyo. Dr. Srofenyo is the medical director for the Greater Accra Regional Hospital, RAGE. He's also a consultant obstetrician gynecologist. You have heard this name over and over and over again. Now you know who an obstetrician gynecologist is, the woman's doctor. Doc, it's a pleasure to have you.
Indeed. It is
You're
also,
welcome.
Thank you so much. Pleasure to be in your program.
It's
Let me
indeed a
send
big
my best
pleasure.
wishes and greetings to your listeners.
Yes, we are very happy to have you.
Thank you so much.
Yes,
Thank you
I
so
know
much.
that you are going to talk about a very important topic today,
Yes.
and that is hypertensive disorders in pregnancy. A big term. What does it mean?
Thank you so much. First of all, when we talk about hypertension, I want the listeners to understand what is hypertension.
Okay.
In God's wisdom, the blood vessels in the body are under a certain pressure, which allows blood to flow through them. And so this pressure is controlled by certain forces.
Okay.
So the pressure can go a little too high or it can go low. So when the pressure goes high, that is what we call hypertension.
Okay.
And for one reason or the other, the pressures go low. We call it hypotension.
Hypotension. Some people may not have heard that before.
Yes.
They only think of hypertension.
Yes. So
But this is
these are
hypo.
the two variables.
Okay.
And then we can have normotensive or normotension, which means that the blood pressures are within the normal range.
What is the normal range?
The normal range is it should be somewhere between 130 or 120 for the top value to around 80. It also depends on our age. It varies depending on our age and the rest.
Okay.
And then for pregnant women, when the top one, which we call the systolic blood pressure, goes above 130, we say that it is going high.
Okay.
And then when the down one is going above 90, again we are worried.
Okay.
So these are the normal levels.
Okay. Dear viewers, you have heard about normal. Normal is normal. Hypo is low. Hyper is high. And then you add the tension. So that is what we're going to talk about today. And we're going to look at the hypertension that occurs in pregnant women. Doc, isn't every pregnant woman who will develop hypertension?
Not at all. It is not every pregnant woman who develops hypertension. It is something that happens to some pregnant women. And we do know the question will be what will cause some pregnant women to develop the hypertension. The fact of the matter is that this is an area that has engaged researchers for years, and up to date we don't know the exact cause, the exact reason why some pregnant women develop hypertension in pregnancy and why some of them do not develop it. Even though we don't know the exact cause of the condition, we do know the risk factors.
The risk factors.
The risk factors. The reason why some people are more prone to develop it, we do know. So we don't know the cause, but we know the risk factors.
And what are some of these?
Yes. So some of the risk factors are extremes of age. When you get pregnant, in extremes of age, very young girls. And let's say you are just about 15, 16 years and you achieve pregnancy, you are at the high.
Now that we have known the various types, what are the signs and symptoms?
Thank you very much. So we are now getting to the more interesting parts of the discussion. Most of the time, this disease can occur to a woman without showing any sign.
She wouldn't know.
She wouldn't know that her blood pressure has gone up. And even for people who are not pregnant, for the average individual, this is one thing about hypertension that makes it so dangerous. That your blood pressure can go up without you knowing. Unless, of course, you happen to go to the hospital. Your blood pressure is checked, and then they will tell you that your blood pressure is 200 over 120.
Yes, I've seen one.
Yes, without knowing, and that is the danger about hypertension. Hypertensive disorders generally. It can be there without knowing. And so therefore, women do develop this condition without knowing. So unless you happen to go to the hospital, antenatal care, the midwife check your blood pressure, and they say, hey, the blood pressure is high. And then they check your urine and say, hey, there is a protein in your urine, and so then they make your diagnosis. And that is why the frameworks of the antenatal program make sure that women go frequently to the antenatal care, so that in case some of these complications are emerging, your visit to the clinic will catch it. Having said that, there are still some symptoms and signs which can occur. One is persistent headache, frontal headache. You may wake
up. Where is the frontal headache? Which part?
Yes, you may wake up in the morning and you'll be having persistent headache, feeling the pain more on the frontage of your head.
All right.
Yes, that is one of the symptoms. Sometimes the worst ones, you may be swollen. Your face may be swollen. Your fingers may be swollen. Your legs may be swollen up to the knee. And when you press it, you see that there is a depression there.
It means that when you press it, goes in.
It goes in.
It doesn't mean you are going to have a boy, right?
No, well, that is our mothers. They use these signs that it means they are going to have a boy.
Yes.
And which is not the truth. The truth is that you may be developing a complication.
Okay.
Yes. So it will be better for you. The worry that we have is that sometimes when they say come in 2 months or come in 1 month, and when the women, because this condition can develop rapidly over a period of 2 weeks.
2 weeks?
You can go to clinic today, everything is fine, but over a period of 2 weeks, your blood pressure can rise and you may start having problems.
Okay.
When that happens, the advice is that don't wait for the 1 month appointment that the midwife has given you.
Yeah.
Just go that this morning I woke up, I'm having severe headache and I don't feel fine, so I'm coming for checkup. the midwife will not sack you,
Yes.
that your appointment time is not due. They will examine you, they will take you through the program, the examination, the blood pressure checks, the urine check. If everything is fine, maybe it's another reason why you are having those problems. They will find the solutions for you and then you go. But sometimes the women will say that, okay, the midwife says I should come in 1 month, so they will wait and wait. But the first lesson that we need to stress for the pregnant woman.
Ladies and gentlemen, this is the online pregnancy school. Today we are talking about some of the complications in pregnancy, and specifically about the hypertensive disorders in pregnancy or hypertensive diseases in pregnancy. We've been given the various types. One thing doctor wants us to understand is that there is something called preeclampsia. And he's now telling us some of the signs and the symptoms that will show that we have this. And he says that you can have pain here, what they call the frontal headache. And if you went to the hospital in the morning and in the evening you have any pain, he says that go back to the hospital. Don't worry at all that when I go, the nurses will say, they will not do that. Even if it is in the night, go to the hospital and tell them that I came to the hospital this morning, but tonight I'm feeling this pain, and that is why I'm here. Now, what are the other symptoms that some women have?
Yes, so we talk about the headache, we talk about the swelling,
Yes.
and then sometimes they may feel dizzy, and that may be all. The fact that I said earlier on is that most times this is a condition that you may not have any sign or something at all, unless it becomes severe. And when it becomes severe, that you may have this headache, the dizziness, the swelling, and then your face will become puffy. And then if nothing is done, then you go on to have fits. This jerky feeling like it has as if you are an epileptic. But this is not epilepsy. Yes.
Wow. So we should not let it go to that stage, right?
Not at all, because it's highly preventable. Getting to that stage, when you get to that stage that you have a fit, you have gotten to the worst stage, and it's so dangerous for your life, for both yourself and then also for the life of the baby.
Doc, when they come to the hospital, is there something that is done for them? Let's say that somebody has a hypertension, has come to the hospital. Is there a process that they take the women through?
Yes, so the antenatal clinic process is a screening process. So all that the midwife is looking for is any problem that she will solve for you. And so everybody's blood pressure is checked. When you appear at the clinic, your blood pressure automatically will be checked, and your urine protein is also checked. So when the midwife checks these two, and he realizes that the blood pressure is high, and then there's urine, there's protein in your urine, even if there's no protein in your urine and your blood pressure is high, the midwife will put you aside. He will ask you some few questions. Do you have headaches? He will examine you, check on the baby, and then he will call the doctor. And then when they see that the blood pressure is high, severely high, they will transfer you to the ward, where you will be admitted at the emergency unit. Over there, they will give you medications to control the blood pressure. And then also, if it is very high, they will also give you some medications to prevent you from developing the fit. So these are the processes that they will take you through. And then, you know, when the condition goes to those severe forms, sometimes they will keep you on admission. They will not let you go home again. Because
for your own good,
for your own
good of
good,
the baby.
yes.
And in fact, the whole family.
For the good of the family, where the healthcare does not really extend. In some countries, you can have health officials who can visit your house, your home, and be checking for you. But in our part of the world, we cannot rely on that. Yeah. That is difficult. And so we normally will keep you on the hospital premises. And then, depending on the severity of the condition, sooner or later, we deliver you, because the condition we know that it is a pregnancy that induced it. And so the only cure eventually is for the baby to be delivered. So that is it. Yes.
Ladies and gentlemen, this is the online pregnancy school. My name is Dr. Linda Vanotu, and today we are looking at complications that can occur in pregnancy. And my guest is a consultant obstetrician gynecologist and also the medical director for the Greater Accra Regional Hospital. He is Dr. Emmanuel Srofena. Let's visit the hospital and see what is done for these women when they go to the hospital.
May I use this opportunity to welcome all of you to the labor ward of the Greater Accra Regional Hospital. For those women who come in labor, this is where they are first received and examined. And then when they are found to have hypertension, then further management of the condition goes on. When I said hypertension in pregnant women, I'm referring to the condition that we call pre-eclampsia or eclampsia, when the woman who have hypertension later on fits during pregnancy. Thank you. Follow me. Because of the condition that we call preeclampsia or hypertension in pregnancy, it's so common among pregnant women. When a pregnant woman comes in labor, one of the first things that we do is to check their blood pressures. And so as you can see, the midwife currently, the senior midwife in charge of this unit, is checking the blood pressure to be sure that the woman's blood pressure is normal. If she checks the blood pressure and it is high, there are other things that she will do. She will also check the urine protein. And when she checks the urine protein and she sees that there is protein in the urine, it gives an indication that the woman probably has that complication. Then she will take the next step. There are medications that she will give to make sure that the blood pressure comes down. There are other medications she will give to make sure that the woman will not go ahead and fit. So we call some of those medications magnesium sulfate, and then antihypertensive medications like nifedipine tablet and nifedipine protocols and so on and so forth. So that is why, and the midwives here, they have been so trained that by themselves, they detect the hypertension, they know what to do, what medications to give, what treatments they should put the patient on, what additional tests that they should do for the patient. So this is the triage unit of the labor ward. We call it the labor triage unit. Every single woman who comes here, the blood pressure is checked just to be sure that it's not coming with any underlying hypertension that will be hidden, that will give her problems during the course of the labor.
And it is the first place of contact for women in labor. When they come, we check their vital signs. As you can see, I'm checking the BP. So if the BP is more than 140, then that you see that there's a problem with her. So we have to check the urine protein too and see what we will do for her. We have the BP medications that controls the BP. We have the VDP protocol. We give Nificat SMR sulfate. Even without the doctor, contacting the doctor before we do those things. So after the primary survey then we go to the secondary survey, which we do behind the screen. We do head-to-toe examination and all other examination for the woman in labor. And if the woman is not in labor and is coming for induction of labor, we do the same thing. We check the vital signs, and if the BP is above the normal, we give the BC medication that we are supposed to be giving to the pregnant women before even informing the doctor.
So let's go on to the Obs and Gynae emergency department, where when women come with severe hypertension as an emergency, where they are admitted to. So follow me. We are now in the Obs and Gynae emergency department. Obs and Gynae emergency department. This is where most of the women who have severe hypertension in pregnancy, this is where they are kept and managed, you know. Or for those who have complications of pregnancy, this is where they are first brought to. And then the necessary management is done. When they are stabilized, then they are later delivered. That is it. For example, you see that cubicle that we label resuscitation. Those who come, whose blood pressures will be very high, who maybe they have fitted, their conditions are not good, we put them in this cubicle. Then we give them drip, we give them the emergency medicines, the things that we have to give them for them to become stable. We do all those things here, and if we have to deliver them, then we transport them from here to the theater for operation or to the labor ward for delivery. So this is what is basically done here.
We admit the patient on bed, then we take samples for such as grouping and cross-matching, FBC, BUE, LFT, and so on. Then after that, we find out from the referral letter whether he has started the MAC sulfate protocol. We have something called MAC sulfate protocol. Sometimes it depends on the BP. When the BP is very high, we start with nifedipine protocol. Yes, then after the nifedipine protocol, we continue with the MAC sulfate protocol. We bring down medicine to bring down the BP and also prevent fit. And we also checked to see whether the baby is alive. We also consider the gestational age. Yeah, if we check it, we give them the drug for the BP to come down. Then for some time, we will observe the patient for some time to see whether the BP is being controlled or not. If it is not controlled, and we look at the gestational age, whether he is about 32, 33, or there's some medicine we give to the pregnant woman to mature the fetal lungs of the baby so that we can either send the patient to theater to deliver the baby. And also sometimes we check to see whether we can insert some medicine for the woman to deliver herself. So we put all those things into consideration. Yes.
Dear viewers, welcome back. Doc, thank you for taking us to the ward. Yeah. Now we saw some of the things that go on at the hospital. Yes. Can you give us a little more detail as to what the midwives were doing and what the doctors also do when they said that they admit them, and this is what we have seen?
Yes.
So what happens?
Yeah, so for example, when we go to labor triage, there's a unit at the Greater Accra Regional Hospital that we call labor triage unit.
Like we saw.
Like we saw. Now, we must know that this condition can occur to you during the pregnancy, but it can also occur to you. You may be normal throughout the pregnancy, but during labor, this condition can then set in.
When you are
about to deliver.
Oh.
When you are about to deliver.
Okay.
The strange thing about this condition is that some women, it occurs to them after delivery.
Wow.
So it can occur during the pregnancy, during labor, and then after delivery. So therefore, when a woman comes in labor, again, we are careful to check her blood pressure and check the urine to make sure that the condition is not emerging during the labor.
Okay.
So at the labor triage unit, which I sent you, you saw that the midwives will check the blood pressure, will check the blood pressure. They have an equipment that they check the blood pressure.
Yes.
And then also they give you a bottle to go and pass urine. They will check the urine in the proteins that are in the urine. They will document it. If they are abnormal, then they will call the doctor. They will give you medication to control the blood pressure. And then they will take you to the emergency, the Ghana emergency unit, which I also took you there to see what they do, how they will classify you. Such cases are high-risk cases. High-risk cases. And so the midwives will put them closer to their station. And then those who don't have any problem, they are the ones that are sent to the other side of the ward.
So it's a whole process.
It is a whole process.
And as you saw, ladies and gentlemen, there is a system in place.
Yeah.
They triage you, which means that they check and see where they should place you. Is this one an emergency that we should do something about quickly? Or this patient or this woman can be put to the bed and let her wait and be examined and be observed. So it's a whole process that you
It is indeed a whole process.
You don't have to wait. Please, don't wait at all. And you can only have these services when you take antenatal seriously and you also follow instructions that are given you at the hospital. Distinguished ladies and gentlemen, this is the online pregnancy school. My name is Dr. Linda Vanotu, and we are talking about complications that can occur or may occur during pregnancy. My guest for today is a consultant obstetrician gynecologist, also the medical chief executive for the Greater Accra Regional Hospital, Dr. Emmanuel Stroffen. Doc.
Yes, one important thing that we have not, that I need to stress, is that rapidly this condition is becoming a leading cause of death in Ghana. In Ghana. In the past, when you look at the statistics, bleeding, after bleeding, like women who deliver, they bleed, those are the major causes of hemorrhage, of death in Ghana. But now, this condition is becoming more and more, it's coming up more.
Why?
The reason is difficult to really establish, but one thing is that now we have blood available.
Okay.
We are managing pregnant women who need blood, we are managing them better. But because women don't still come up early, so the preeclampsia is like we still don't have control. Even though we have medicines that we can prevent the fit and the other complications, unless the woman comes to the hospital early. If the woman comes late, you can have all these medications, but it will still not benefit the woman.
Yeah.
And so now when you go to Kolebu Teaching Hospital, the Greater Accra Regional Hospital, Pamphonati Teaching Hospital, the bigger hospital,
Yes.
this has become the leading cause of death.
The leading cause, which is preventable.
Which is very highly preventable. It causes maternal mortality and also stillbirth, perinatal mortality.
Unfortunately.
Unfortunately. And this is what we don't want. This is, the government have programs in place in order to protect the life of the women. But we need the cooperation of the women themselves.
And the husbands.
And the husbands. Sorry, actually, the cooperation of the husbands and then the women.
Yeah. Doc,
Yes.
what are the complications of this preeclampsia?
Thank you so much. So the main complications of this condition, first of all, the one that can affect the brain, that is what I spoke about, that can lead to the eclampsia. So, number two, still in the brain, it can let some of your blood vessels burst because the pressure on the vessel has gone too high.
Yeah.
The blood vessel can burst and you can have stroke. What we call stroke, it can happen to you. And then coming back to the heart, it can let the heart fail because the pressure is too much. It's the heart that pumps the blood. So if the pressure in the system is too much, the heart can fail. It can also affect your lungs. It can affect the liver. So the liver can become swollen and then fail in its functions. It can also damage the kidneys. So your kidneys will not work well. Some people may have severe forms, so severe that by the time they recover, their kidneys never recover. So they end up having a chronic kidney disease. Yes. So the fact that
when you have preeclampsia,
when you have the severe form of preeclampsia, almost all your systems in the body, all your major organs, and that is the organ that transfers food and oxygen to the baby and carries carbon dioxide away from the baby to the mother for the mother to excrete. And so if the placenta doesn't function well, the baby is not going to grow well. Yes, so this is also one of the complications. So it can affect the placenta and then the baby will not grow well. And it's rare in some cases the baby may even die also in the womb.
while still in the womb.
While still in the womb. Sometimes the placenta, the functions of the placenta are so affected that it can even prematurely separate from the mother. Normally, with the liver, you have to deliver before the after birth separates and come out. But because of this condition, if it is severe and attention is not paid, it can cause the placenta to prematurely separate from the woman.
Before the baby is born.
Yes, and in that case, the baby will die. Because the placenta that keeps the baby alive.
Yes.
So these are the dangers. And when that happens, it's not only the baby who is in danger, the mom is also in danger because it causes severe complications. So indeed, every organ of the body experiences some problem in one way or the other. Even your eye can be affected. Your vision can be affected.
So it means from head to toe?
From the head, the brain, the eyes, the throat, your larynxes can cause laryngeal edema or edema of your windpipe.
And swelling.
Yeah, your windpipe can swell up so that you find it difficult to breathe, or when you are breathing, you'll be creating some sounds. And people will take it that, oh, this is normal in pregnancy. Please, when you experience those things in the house, go to the hospital. It may be a telltale sign that something is happening. So from the head, the eyes can be affected, the throat, the windpipe can be affected, your lungs, your heart, your kidneys, your liver, and then the placenta, the baby. All these systems can be affected by
And you can also have a stroke in addition to that.
You can even have a stroke. in addition, it can permanently damage your kidneys. You know the kidney, God gave us only 2.
Yes.
And so when they get damaged, that is it.
There's nothing.
There is nothing you can do. They will say you have to undergo dialysis for the rest of your life. And that is something that is not pleasant.
And it's not cheap.
And it's not cheap. So if there is anything we can do to prevent these complications, then it's better for us to go. We are not putting fear in people not to get pregnant, because that is the only way we can reproduce the population.
Yeah.
But then we need to take pregnancy seriously. That when you achieve pregnancy, it is a serious thing that you must have time and pay attention to your body and follow the rules and the regulations that they say you should come for antenatal. When the midwife give you the deed, you have to abide by it.
Yeah.
Sometimes the midwife will give you appointment and people will not go.
They will not go.
They say their husbands have gone to trek.
But when the husband was sleeping, he didn't carry the pregnancy away. The pregnancy was still with you.
Yes.
Dear viewers, please.
There was one unfortunate situation where the woman was having a problem throughout the night. That is why I like the caution you gave. Even when you go to the clinic in the morning, by evening you're having a problem.
Go back.
Don't wait for the next day. This woman, I always remember her. She went to the clinic according to the records in the morning, and her blood pressure was normal. But in the night, she was having severe headaches. So instead of coming back, they waited till the daybreak.
Oh.
In the morning, they now went to the clinic where they went. When they went, her blood pressure was high. And then when they referred her, she went back to the home to tell her husband that I have been referred to rape. And then now they have to mobilize themselves. So having to mobilize themselves, she started fitting. Now she has developed the worst form before they came. So that was a very bad situation. By the grace of God, she survived. Yes. But that was a dangerous, it was a risky behavior that they carried out.
Dear viewers, this is the online pregnancy school, and we are listening to a colleague who is an obstetrician, gynecologist, a consultant at that, and he's also the medical director for the Greater Accra Regional Hospital, Dr. Emmanuel Srofeno. He has seen so many pregnant women. He has a lot of experience with pregnant women, and that is why when he's telling us that we should go to the antenatal when we are asked to go, please do that. The disease can come, but we have the structures in place to help you. So please, please, please don't stay at home. If you go to the hospital and you even get home and you find that there's something wrong, just go back. And for the men, because the women love you so much, they want you to tell them to go to the hospital before they go. So please, show interest. When the woman goes to the hospital for antenatal and comes back, ask what is wrong. Ask whether everything is okay. Ask whether she was told to do something so that you can support her. And through this education, our hope is that we'll be able to reduce maternal mortality and also reduce childhood deaths. Look, so these things happen to the woman. What about the baby? How will she know that the baby is not well? So she has to go to the hospital.
Okay, so the woman herself may have some signs and symptoms like the persistent headache that I spoke about. But as far as the baby is concerned, the only sign that the woman may feel is that she may feel that the baby's movement had reduced. So that is why we also educate the women, and these days we even have a chart. Sometimes for the high-risk women that we give them the chart. That when you are there and you feel that the baby is not kicking the way it used to kick, do not wait for the next Monday or your next appointment. Just go to the hospital. It could be that something is happening to the baby. It could also be that it's the preeclampsia that is affecting the baby. So when you go, it will save the baby's life and also save your own life. So as far as the baby is concerned, another sign could be that the baby may not be growing well. You know, when you go to the hospital, the midwives measure the size of the abdomen and then they compare it with the age of the pregnancy. And we are always comparing. When we see, it's a sign that the placenta may not be functioning well, and that will also be a sign of some preeclampsia. It could be some people, the blood pressure may not be so high, but the disease is still underneath, causing problems. So we look for both sides, both the baby and also the mother.
Thank you very much. No, now somebody will be wondering, hey, then if I have this, it means I'm gone. Well, is there something that can be done for them? What is the treatment? Is there any treatment?
Oh, yes, there is treatment.
Yes.
As I said, it's a hypertensive disorder. So the first thing we do is that we give you medications to control the blood pressure. And those who have the severe forms, we give them another medicine which will prevent them from fitting. And then we'll make sure that all your organ systems are stabilized. And at the right time, we deliver the baby and remove the placenta so that you'll be free. Gradually, your blood pressure comes back to normal. This is what we do. But during the antenatal period, some of the new systems we are putting in place, we want every pregnant woman to have a midwife so that it will make communication better. Because some of the people, maybe they stay far away, they are not sure.
Yes.
But you can call it midwife. You can call it midwife. The midwife, today I was there to see you, but this evening my head is paining me. The midwife will advise you report to the emergency.
Yes.
Because they want somebody that they can talk to directly.
Exactly.
Yes. And so right now, when you come, we allocate you to a midwife. And when you come anytime, that's the midwife you will see. So that you become accustomed and used to that midwife. You know the midwife also knows you. So you have a relationship.
Yes.
You exchange numbers. You can call her anytime or send her a WhatsApp message that, oh, I have this problem. Then she will respond to you and advise you what to do. So that is one of the systems that we put in place.
Good. Doc, I know that there's also another system where there's a link. So if I'm not attending a clinic at Rage, but I go to another hospital, there is a system in place, right? Even on the WhatsApp.
Yes.
Where if I go to a particular hospital, they can talk to you, that is Rage, or to you, or to any of the other people. Can you tell us a little about that?
Okay, so those systems are still there, where we have linked all the hospitals that work with Rage. We link all of them together on a WhatsApp platform. So anytime, if you report to your hospital and they see that you have a serious condition, like your blood pressure is so high that they can't handle,